Mr. President, I come to the floor today, and the Republican leader has already addressed you in this body to discuss the issues of health care in this country, about new revelations, new information that has come forth in terms of the specifics of the cost of the health care bill that has been signed into law, the costs that far exceed what was ever anticipated. And so I come to the floor as someone who's practiced medicine in Wyoming for 25 years, orthopedic surgeon taking care of families all across the state of Wyoming, was also medical director of the Wyoming Health Fairs, and it's a program providing low-cost health screenings to people all around the state of Wyoming. This gave people an opportunity to take more responsibility for their own health and keep down the cost of their medical care. So I come to the floor today with a second opinion, my second opinion as a physician, a practicing physician, taking care of patients. And it's a second opinion about the health care law. Today I come to the floor because the goal of the health care bill was truly to improve quality and improve access and get the cost of care down. Those are the things I think all of the Senate wanted to have achieved. But having seen this bill that's been passed into law, signed into law, I believe that this bill is going to be bad for patients, bad for our providers, our nurses and doctors who take care of those patients, and bad for our payers, the American people, the people that are going to foot the bill for this health care bill. I believe that this bill, fundamentally, as it has been passed into law, is going to result in higher costs for patients. It's going to result in less access to care for people all across America. And it's going to result in unsustainable spending, Mr. President, at a time when we are running record deficits. So I think about things that the President said when he was not just running for office, but as President. He said, the plan I'm announcing tonight, he said this to a joint session of Congress, he said, the plan I'm announcing tonight will slow the growth of health care costs for our families, he said, for our businesses and for our government. But in fact, Mr. President, the chief actuary for Medicare and Medicaid said that the President was wrong, said that the cost of care will actually go up by $311 billion through 2019. And now the revelation yesterday from the Congressional Budget Office that when you take a look at some of the things that hadn't been scored, as they say, costed out, it's going to add another $115 billion on top of that. The President said if you like your health care plan, you'll be able to keep your health care plan, period. He actually said the word period. He said, no one will take it away, period. No matter what, period. But the Congressional Budget Office and the chief actuary for Medicare and Medicaid says that 14 million Americans will lose their employer-sponsored health coverage under the new law. So today, Mr. President, I come to the floor to also mention that recently the Secretary of Health and Human Services, Kathleen Sebelius, had an epiphany about the doctor shortage in America. Last week, she said a nationwide primary care physician shortage had to be addressed before over 30 million Americans get access to subsidized health insurance coverage. And this is her quote. She said, "How are we going to be ready when we already have a shortage in too many parts of the country?" Well, this shortage should not have been a surprise to the Secretary of Health and Human Services. The American Association of Medical Colleges tells us at the current graduation and training rates, we are facing a shortage of 150,000 doctors in the next 15 years. Over the past year, medical experts warned Congress, warned this body, warned the administration that any health reform bill should tackle the issue of physician shortages. But instead of helping doctors, the new law actually discourages the next generation from becoming doctors. This new bill cuts payments for doctors and cuts for patients on Medicare, and it doesn't include enough money to train new doctors. I believe it was intentional. Mr. President, maybe the Secretary, maybe the Obama administration, maybe Democrats in Congress should have paid attention to the experts before jamming this health care law down the throats of the American people. Maybe they should have heeded the calls that I heard from medical professionals all across Wyoming and across the country. Slow down. Let's get it right. But no, they didn't. And now the American people are stuck with a law that costs too much, doesn't solve America's doctor shortage, doesn't even address it, and doesn't deliver good care for patients. Now, Mr. President, this should not have been a surprise to the Secretary, because the Wall Street Journal actually over a month ago says medical schools can't keep up. As ranks of insured expand, nation faces shortage of 150,000 doctors. Now, right here, it says a shortage of primary care and other physicians could mean more limited access to health care and longer wait times. More limited access, more wait times. And what about the training of doctors? Right here. Now, the Secretary apparently has just realized this, but it's been in print for well over a month. Doctors' groups and medical schools had hoped that the new health care law passed in March would increase the number of funded residency slots, you know, where they train family doctors. But such a provision didn't make it into the final bill. The now over $1 trillion bill, but are we going to train doctors? No, they left it out. And then what about hospitals? Well, here it is, Wall Street Journal, hospitals under the knife. New York City system aims to cut 2,600 more jobs as state funding drops. And not enough doctors? Well, all you have to do is go to the New York Times. More doctors giving up private clinics. That's the end of it. So why would so many doctors behave this way? Well, let's look at Congress Daily just this past week, May 4th. Latest CBO figures show higher doc fixed price tag. That's to pay for doctors for the doctor bill. Of course, it was left out of the health care bill. How can we have a national health care law that fails to address training doctors and paying for doctors? It is astonishing, Mr. President. It says that the scheduled cuts take effect June 1st. An option outlined Friday by CBO to freeze Medicare payment rates, which under the new figures would cost $275.8 billion through 2020. An amazing amount, because physician payment rates for Medicare are expected to be cut 21% on June 1st. So that's what we're looking at now. And Mr. President, that's why today I come to the floor giving my doctor's second opinion, because it is time to repeal this legislation and to replace it with legislation that delivers more personal responsibility and more opportunities for individual patients. We need a patient-centered health care bill, one that provides individual incentives, such as premium breaks for people that behave in a way that encourages healthy behavior and gets down the risk factors that increase the cost of care, that allows people to take their health insurance with them when they switch jobs, that gives people who buy their own health insurance the same tax relief that's available to people who get their insurance through work, that allows Americans to buy health insurance across state lines, that deals with lawsuit abuse, and that allows small businesses to join together in order to offer health insurance to their employees. These are the things, Mr. President, that will work to get down the cost of care and deliver higher quality of care to the American people. But, Mr. President, they are not in the health care bill that passed the Senate, that passed the House, and was signed into law. And that is why, Mr. President, today, once again, in light of this brand new information on the increased cost and the final realization that the Secretary of Health and Human Services now says, gee, we don't have enough doctors to cover the situation, it is time to repeal this bill and replace it with what we know will work for the American people. Thank you, Mr. President. I yield the floor.